in Canada, but for many parts of the world, people do not have a mattress.
No.
What's happening in terms of your ministry on this side? Are you getting the message out, or other people getting involved with you in a voluntary capacity?
One of the wonderful things, and the way the Lord is helping us in our ministry, is because we take a group of people to Kenya every year. For example, in January, the latter part of January, I have 33 people going with me to Kenya. There are doctors and dentists and teachers and farmers and water specialists and engineers and students and physiotherapists and other professionals. And we all pay our own expenses. Every penny, our cost of overhead, by the way, is less than 5%. Because we have no staff, we have no fixed overhead. So anyway, when we go there, some of these people are from out west, some are from down south, one person is from Arizona. And so word gets spread through, they go home and they tell their neighbors and they tell their churches and they do presentations. And so because of that activity of going to Kenya and administering to the people in our vision, medical, and dental clinics, we have, like for example, the trip next year, we have 12 people on the list already, and everybody pays every cent of their own way. We use no donations to fund our trips in any way.
That's terrific, and you can be sure that all of these people are happy to do it.
Oh yes.
And even the professionals who take time off from their practices and taking a financial loss because of it are finding meaning and significance and a sense of active faith in doing this work. The church has been supportive of your work?
Absolutely. Yeah. Absolutely.
Now,
we get support from many churches on PEI. I do presentations at the churches at their Sunday services, and they'll come to me and they'll say, "We'd like to support your work. What do you have a project that might cost, say, $5,000 a year?" And so they'll take on, like this one church, Presbyterian church in where we live, and they've taken on a new feeding program that we introduced in a mountain village called Thuri. And so the $5,000 that they will fundraise for us will go to feeding, to rehiring the teacher at the little kindergarten and getting the kids back because they couldn't afford to pay the teacher and they had no money.
You know, I've often said and thought and believe that the finest stimulus or catalyst for ecumenical work on the planet is ministry to the poor.
Yes. I agree with that.
People don't care if you're Presbyterian or Lutheran or Roman Catholic or Pentecostal or charismatic or non-aligned. When you see children who need food and homes that need healing, it's Christ in you, the hope of glory that just reaches out regardless of denominational affiliation.
Yeah, the churches in PEI are very supportive. All churches are really supportive, and places like Rotary clubs and Lions clubs and, and schools, and it's just I'm just astounded by the support.
No, absolutely. I fully understand what you're saying. What impact is this having on you and your wife personally?
This has become a passion of ours. We live, eat, and breathe Mikinduri every day, and because we have no salary people, it falls on somebody to manage the project, and so that falls on Rita and I. And but it's blessed work. We're so blessed. People think, well, it must be great the work you're doing in Kenya. It's amazing how blessed we are when we go to Kenya and come home. And
you wonder who's ministering to whom here. Are we ministering to them, or are they ministering to us?
Exactly.
Now, you're currently in a fundraising drive. Tell me about that.
Well, one of the things that we've been working at over the medical professionals that come with me, when they go there and they get a chance to assess the medical situation in Kenya and what's needed and where the holes are, we discover that there are many very remote villages where when a child gets hurt or falls in a fire or breaks a leg, or an adult, they heal at home, and very often they heal very painfully and not very well. I mean, they're deformed and so on. So one of the things that we're in the process of implementing after doing quite a bit of research is what we call a community-based healthcare system, where the leaders in these remote communities will be tasked with the job of acting as a medical sieve, a medic sieve, so that those people that have fallen on really serious illnesses will get a chance to get to the hospital, because hospital is not a word in their vocabulary. It just isn't, as you know. And so the program that we're introducing now, I'm calling it Medic Aid. we need $50,000 to launch this program. We have to hire a consultant to do a readiness study, we have to hire a consultant to initiate our program, and we have to hire the community-based healthcare workers at some level. We're not sure yet. We're still doing our research. When we go in January, we're spending another 10 days in research with organizations like the Association of the Physically Handicapped for Kenya, the Kikuyu Eye Clinic, AMREF, which is the African Medical Research Education Foundation. So these are the people that we hope to partner with to establish the training program for the community-based healthcare workers who will then minister to the people in these very remote areas by teaching them things like human rights for women, for example. Things like just boiling water and respiratory conditions and all, just stuff like that. So the $50,000 that we're hoping to raise will be the initial, that's what we need for the 2011 to be able to launch this program and launch it in a professional, thorough way.
Yeah, and if any of you want to know more about this and are moved by what Ted is talking about, you can link up with him through our website. You just log on to our website, just crossroads.ca/missions, and we'll be able to connect you with Ted and his work. Just a final minute, Ted. Do you have children?
Yes, I do.
Your kids,
3 children and 5 grandchildren.
And 5 grandchildren. Yeah. So they're all your kids are adults.
Yes.
What do they think of their wild motorcycle riding dad going all over the world doing this remarkable work?
Well, you know, they're very proud of. I'm amazed when they come to me. Our grandson Chandler, who is in grade. He's 12, and last year he had to do a school project, so he did a project on his grandpa going to Kenya to work. So you're touched by those little things.
Well, yeah, and it's an inspiration to your kids and your grandkids.
Yeah.
You know, the ramifications, the domino effect of a simple and random act of kindness is profound.
Yeah. If I could just say, Jim, in closing, if that's where we are, you know, I mentioned we take people to Kenya. Yeah. We just don't need doctors and nurses, and we need ordinary people like me. I'm a retired business person, and we need people like me just to help us with the logistics. And these people go home to their own communities and become ways of spreading the word and getting more volunteers and more funding and so on.
Absolutely. They become ambassadors for the big picture.
So anybody that has an interest in exploring the possibility of going to Kenya, if they go to our website...
what is your website?
It's www.mikinduri.com.
Okay, Mikinduri, how do you spell Mikinduri?
M-I-K-I-N-D-U-R-I.
Mikinduri.com, just the way it sounds.
Yeah.
Ted, thanks for coming our way.
My pleasure. Thank you for having me.
And Merry Christmas to you.
Thank you, and to you and your family.
Thank you.